Welcome, everyone. My name's Aline Sigler. I'm with Provider Outreach and Education. Also on the line with me today is my friend and coworker, Ashley Dakota. She's serving as my co-host today, and I appreciate her assistance. Thank you for joining us for this installment of our New to Medicare Education. Today, we'll be talking about some of the contractors and agencies that you might encounter on your Medicare journey. I realize we have people with all different roles, responsibilities, and experience levels on the line today. Some of you might be practitioners or billers. Maybe we have some compliance staff or medical records people. This is a beginner level course. So with that being said, this is going to be a brief overview of those different entities, but we'll provide you tons of resources where you can go to learn even more. The purpose of this session is to familiarize yourself with several contractors, agencies, and organizations that play a key role in supporting the operations of the Medicare program. We're going to do that by introducing you to some of them. Some of them you may know, you've heard of them, and some you may not. What's their purpose? What do they do? And more importantly, how does it affect you? Along the way, I'm going to share links to resources, websites, and publications where you can go to learn more as you continue on with your Medicare education. Before we get into that material, let me say one thing. I don't want you to beat yourself up by trying to feverishly take notes or think that you have to memorize anything in this presentation. It is recorded so you can review it again. There's no test, and I'm going to give you lots of resources that you can use at a later point in time if you need to. So you've heard the saying, too many cooks spoil the soup. Well, that's not the case here. We're having a little fun using the analogy of a restaurant kitchen. A well-run kitchen operates under a hierarchical brigade system to ensure efficiency, and it has everyone ranging from executive leaderships to specialized station cooks and even cleaning staff. The structure, often modeled after military standards, allows for a clear delegation of responsibility. This workflow optimization approach has specialized positions to prevent bottlenecking, allowing the kitchen to handle high volume service efficiently. So we can apply the same principle as we think about Medicare. Medicare provides health coverage to more than 68 million adults age 65 and older, and younger people with disabilities. So it requires precision, efficiency, and clear designation of responsibilities to operate smoothly, just like our restaurant kitchen. Medicare is administered by a number of federal agencies. Of course, there's too many to mention all of them in the time that we have here today, but we'll outline quite a few. Starting with the U.S. Department of Health and Human Services, HHS. That's the presidential cabinet entity that serves as the primary federal agency responsible for the operational integrity and policy direction of the Medicare program. They ensure coverage for millions, establish payment models, combat fraud, and guarantee quality of care. HHS is a huge agency. I've included a link to their website if you're interested in reading more about what they do. Overall, HHS plays a central role in the Medicare program by overseeing its administration, financing, and policy through its largest division, which is the Centers for Medicare and Medicaid Services, known as CMS, which is what we're going to talk about next. CMS oversees and administers the Medicare program. CMS functions as an insurance payer and regulator, implementing and enforcing laws that affect Medicare beneficiaries, health plans, providers and private insurers offering Medicare Advantage and Part D drug plans. Within the scope of its statutory authority, CMS sets provider payment rates, makes coverage decisions, and coordinates benefits for beneficiaries. Its Center for Medicare serves as the central office for these policies and operations. They develop and enforce quality and safety standards that providers must meet in order to participate in the Medicare and Medicaid programs. The agency also contracts with state survey agencies to enforce nursing home standards and works to combat fraud and abuse, often in collaboration with some of the other entities that we're going to be talking about. CMS is also responsible for consumer information and protections, including managing the 1-800 Medicare helpline, the Medicare.gov website, distributing the Medicare and You handbook, and supporting those that assist beneficiaries with complaints, appeals, and other Medicare-related inquiries. At the bottom of this slide and on several slides within the presentation, I've provided links, and this one is to both the CMS.gov website, which will become your number one go-to best friend as you progress in your Medicare education, and the Medicare.gov website. Now, it's aimed at the beneficiary population, but it has a lot of information and it's an easy to understand language. So for those of you, and I'm not trying to talk down to anybody, those of you that are brand new in learning about Medicare, Medicare billing, Medicare coverage, whatever the case may be, that beneficiary website can really help you with the basics. So don't be ashamed to go there and learn about Medicare through the eyes of a Medicare beneficiary. The next federal agency is the Social Security Administration. They play a central role in determining Medicare eligibility and enrolling individuals into the program. So to enroll in Medicare, you do that through the Social Security Administration in most cases. Social Security also handles automatic deductions of monthly Medicare Part B premiums from Social Security benefits. They also receive data from the Internal Revenue Service to determine income-related monthly adjustment amounts for higher income beneficiaries. Social Security is responsible for processing name changes, and along with CMS, can mail replacement Medicare cards. The link on this slide in the footer here will take you to the Social Security Administration's website. Again, there's a lot of information out there, just like with the CMS website, because it's not just Medicare that they deal with. But again, giving you places to go to find the information that you need. The Railroad Retirement Board is an independent agency in the executive branch of the federal government. Their primary function is to administer comprehensive retirement survivor annuities and unemployment sickness benefits for the nation's railroad workers and their families under the Railroad Retirement and Railroad Unemployment Insurance Acts. Railroad Medicare is a specialized Medicare program for railroad retirees, their families, and survivors, administered by the Railroad Retirement Board rather than Social Security. The Railroad Retirement Board handles enrollment and premium deductions from annuity payments. It provides identical coverage to traditional Medicare, but it uses a specialized contractor which is Palmetto GBA, to process Part B claims. And we'll cover that in just a few minutes. If you'd like to read about this agency and what they do, you can go to their website. This link takes you to their main page. I have one later on that's specifically for the Railroad Medicare section. We'll talk about that in just a few minutes. So you're going to need to know if the patient that's come to your office or your facility is covered by traditional Medicare or Railroad Medicare. You're not going to know by looking at their Medicare number. You used to be able to do that, but no longer. You have to look at their card. So I've included an example of each of them here. You'll notice the image on the right has the Railroad Retirement logo. And then down here in the lower banner, it actually says Railroad Retirement Board. Now, if you check eligibility using the HIPAA eligibility transaction system, which is called HETS, and don't worry if you've never heard of that before. Remember, you're just getting started in your education. If you're checking eligibility there, it actually will give you a message in the message segment of that eligibility transaction response if your patient's eligible for Medicare under the Railroad Retirement Benefit. It will actually say Railroad Retirement Medicare Beneficiary. So I just wanted to point that out. How do you know? Well, you don't know by looking at the Medicare number anymore because they are random numbers and letters, and that's for protection of the Medicare Trust Fund and the beneficiary. Next up, we have Federal District Court. They review cases regarding coverage denials, fraud, and Medicare regulatory challenges. They also serve as the fifth and final level of appeals for Medicare disputes, allowing beneficiaries or providers to challenge in federal court decisions made by the Medicare Appeals Council, which is level 4 appeals. Of course, that's just a tiny bit of what they do, but you can find out more if you want to by going to the U.S. Courts website. I'm sure we've all heard of this agency, but you might not know how they relate to Medicare. The FBI is the primary federal agency responsible for investigating healthcare fraud, including schemes targeting Medicare, Medicaid, and private insurers. Fraud is the intentional deception of healthcare systems to receive benefits or payments to which you're not entitled to. Working with the Department of Justice and the Office of Inspector General, the FBI identifies, investigates, and prosecutes fraudulent billing, kickbacks, and in some cases, drug diversion. Key aspects of the FBI's involvement with Medicare includes the Medicare Fraud Strike Force. They use advanced data analysis to detect abnormal billing patterns. The FBI has partnerships and works closely with other agencies. I mentioned the OIG and the DOJ, but this also includes CMS and the Drug Enforcement Agency. They do that to investigate various types of fraud. These investigations aim to stop scams that steal money from the Medicare system and to protect beneficiaries from things like stolen Medicare numbers and the overprescribing of controlled substances. You can read more about what they do, major investigations, statistics, and scams on their website if you're interested. The Office of Inspector General, OIG, that's an independent body that oversees Health and Human Service programs with a focus on preventing and reducing waste, fraud, and abuse. Among other things, its activities include auditing healthcare providers and contractors, collaborating with the Department of Justice, like I mentioned on the previous slide, and enforcing penalties against entities that have been convicted of violations. The OIG website contains lots of interesting information, and we'll be talking a little bit more about some of the other aspects they do a little bit later in the presentation. Now, of course, that's not all of the federal agencies that are involved with Medicare, but the main ones and the ones that are good to know about. So we're going to move on to contractors. Medicare involves several private contractors that are hired by CMS to manage day-to-day operations. They must bid on and are awarded a contract through competitive procedures with specific duties outlined. So what I did is I combined them into similar categories based on their scope of work, and I came up with claims processing, medical review, and fraud and abuse. So the first category that we're going to take a look at is claims processing contractors. And the ones that we'll highlight are the AB Medicare Administrative Contractor, or MAC, the Durable Medical Equipment MAC, Home Health and Hospice MAC, Railroad Retirement Board Specialty MAC, and Medicare Secondary Payer Contractors. We'll talk about each one of these in a little bit more detail. Starting with the AB MACs, they handle claims, enrollment, and provider services. These are the main operational contact, processing Part A and Part B claims and performing other functions related to claims processing. They are assigned specific geographic jurisdictions. Their responsibilities include the items that you see listed here. It's not an all-inclusive list. So processing Medicare fee-for-service claims, enrolling healthcare providers, processing redetermination requests, which is the first level of appeal, responding to inquiries and educating providers on billing, and reviewing medical review records to ensure compliance with Medicare regulations. The link to the CMS website here, down at the bottom of the slide, has the definition and information about the MACs. WPS is the AB MAC for jurisdictions 5 and jurisdictions 8. The DME MAC is a specialty MAC that provides for the processing of Medicare claims for durable medical equipment, prosthetics, orthotics, and supplies. They perform many of the same related activities as the AB MAC, such as reviewing medical records to ensure compliance and providing supplier education. Their contracts are also assigned with specific geographic jurisdictions. CMS has information about who the DME MACs are and highlights with links to their individual websites. So this CMS webpage that I've given you down here, who are the MACs? This will take you to the section of that website that, or that web page, excuse me, that explains what the DME MAC is and then links to who they are. So you can find out for your state where you're specifically located, who's the DME MAC for your area. Home health and hospice MACs are pretty self-explanatory. They're specialized regional contractors responsible for processing Medicare Part A and B claims for home health agencies and hospices. They're responsible for claims adjudication, provider enrollment, fraud prevention, provider education, medical review, and appeals. Check out that Who Are the MACs webpage that I referred you to before. You can go to the section about the home health and hospice to find out who the contractors are and what states belong to which region. We already talked a little bit about the Railroad Retirement Board in our discussion of federal entities, but they also process claims, so they're also included in this section with contractors. The Railroad Specialty MAC processes Part B claims for railroad workers, their families, and beneficiaries. Now, this is a nationwide contract, and it's held by Palmetto GBA. They handle questions from customers, process appeals, and provide education. The link here directs you to the Medicare portion of their website. So this is a different link than what I had on the Railroad Retirement Board slide that we saw earlier. This one is specific to Medicare. On to the BCRC. I told you this PowerPoint was full of acronyms. The Benefits Coordination and Recovery Center. Now, I put this statement at the very top with the very first bullet. They don't process claims, but a lot of claims can't process correctly without them. So that's why I included them in this section about claims processing contractors. The BCRC identifies when other insurance coverage for beneficiaries is present and possibly primary to Medicare. This is to ensure that Medicare is not paying for services that should be covered by another payer. We call this Medicare secondary payer, or MSP. The BCRC maintains records related to other insurances and recover conditional payments. A conditional payment is a temporary payment made by Medicare for healthcare services when another payer, such as liability, no fault, or workers' compensation insurance, is responsible, but they don't pay promptly. So it's a conditional payment because it has to be repaid to Medicare once a settlement, judgment, or award is secured. The CMS non-group health plan recovery page talks about this more in depth, and that's the link that I gave you at the bottom of this slide. The other MSP contractor that I'll mention is the Commercial Repayment Center. Again, they don't process claims, but they do impact claims processing. They work diligently to identify and recover incorrect payments also. Unlike the BCRC, they cannot update the MSP files by opening or closing records. So this again goes back to those specialized plans of work that all of these different contractors and entities have. And that goes back to that kitchen analogy, comparing how the Medicare contractors are structured with specialized positions, and that is to ensure safety, efficiency, and allow for clear delegation of responsibility. To prevent improper payments and protect the Medicare Trust Fund, Medicare contractors operate the Medical Review Program. Medical review involves the collection and clinical review of medical records and related information to ensure that payment is made only for services that meet all Medicare coverage, coding, billing, and medical necessity requirements. The purpose of the Medical Review Program is to identify errors through claims analysis and/or medical record review activities. Contractors use this information to help ensure they provide proper Medicare payments and recover any improper payments if the claim was already paid. Contractors also provide education to help ensure future compliance. So we don't just want to identify errors and identify improper payments. We want to prevent them from happening. So that education component is very important in the medical review programs. So in this next section, we're going to transition some of the contractors involved in that medical review process. So I'll just go down the list here and then we'll look at them individually. The ABMAC, the Comprehensive Error Rate Testing or CERT contractor, the Supplemental Medical Review Contractor, or the SMRC, the Recovery Audit Contractor, or RAC, and the Qualified Independent Contractor, or QUIC. Of course, they all have acronyms associated with them. The link I have here for you is the CMS Medical Review and Education webpage. Starting with the ABMAC. They review claims for accuracy and medical necessity. And they do this through what we call the Targeted Probe and Educate, or TPE program. Another task they do is develop local coverage policies, and we call those local coverage determinations, or LCDs. There are also national coverage determinations, which are developed and maintained by CMS. So the MACs perform prior authorization reviews also for some services, such as certain hospital outpatient department services and repetitive scheduled non-emergent ambulance transports. Details about the review topics, documentation checklists, and record submission instructions can be found on the WPS website using the link on this slide. Remember that if you're listening to this course as an encore, these links are in the description of the video. The CERT contractor, or program. The CERT program is to measure improper payments in the Medicare fee-for-service program. Now, when I say fee-for-service, that's traditional or original Medicare, Medicare A and B. This entity reviews a statistically valid sample of claims to calculate the improper payment rate. These are claims that have already been processed by the MAC. They can be paid or unpaid. So in essence, they're measuring the performance of the MACs. They're looking to see if we've processed the claims correctly. CERT provides insight into the cause of errors. MACs analyze the results to determine educational needs to help decrease error rates. We're all working together to ensure that Medicare pays, but only when appropriate. Now, as you can see here, there is a review contractor and a statistical contractor involved in the program, and they're operated by two separate entities. And the CERT webpage of the CMS website gives you additional details about the program, the timelines involved, about the additional documentation requests, and so on. Much more than we can go into in this entry-level course. The Supplemental Medical Review Contractor, SMRC, conducts medical review activities as directed by CMS in order to lower the improper payment rate and increase efficiencies of medical review functions of the Medicare program. So the SMRC is unique in that it doesn't fall under CERT. It doesn't fall under RAC, and I realize we haven't talked about that one yet. But it truly is supplemental or special based on CMS directives. So the project review types are based on data analysis, and you can find a list of current projects on the SMRC website. This is a nationwide contract, currently is held by Noridian Healthcare Solutions. I've included a link to the SMRC webpage of the CMS website, so you can use it as a jumping off point to get further education as you need to. What do we have next here? Okay, we have the Recovery Audit Contractor, the RAC. They are tasked with identifying and recovering improper payments. The RACs conduct both complex and automated post-payment reviews. What does that mean? An automated review occurs at the system, an edit in the system, where the system is programmed to look for certain things. Complex medical review requires an actual person to review the medical review records. And I say that because if you're new and you didn't realize what these two terms meant, it might be even more confusing than it already is. Review topics that the RAC uses have to be approved by CMS, and they are actually published on the RAC's website before the reviews start. So you can see at any time what they're focusing on, what their reviews are. And so then if you provide those types of services or you're that type of provider, then you'll know that perhaps they might, be asking you for records and reviewing some of your claims. So I invite you to learn more about the RAC program, what it is, and how it operates by using the link on the bottom of this slide here. Qualified Independent Contractor, UPIC. They're responsible for conducting the second level of appeal called the reconsideration. In case you didn't know, the first level is handled by the ABMAC. I think I mentioned that before. And it's called a redetermination. So the UPIC also reviews dismissals of first level of appeals. So let's say you submit a redetermination request to WPS, but we determine that the request doesn't meet technical, procedural, or timeliness requirements. So then, excuse me, you can ask the UPIC to review the actual dismissal. So to put it in simpler terms, the appeal is invalid, incomplete, or filed late without justification. CMS has a web page for each of the 5 levels of appeal. They each have their own timelines for submission and timelines for finalization. You can find all that out because they're handled by different entities. So I've included the link to the one that's focused on reconsiderations because that's what the UPIC does. Now we've made it to the portion of the presentation where we're going to discuss fraud and abuse contractors. And I've mentioned fraud, waste, and abuse many times already. And that's because it's so important. And there are a lot of entities working on it, working together on it to put out those fires that can jeopardize the Medicare Trust Fund. So we have the Unified Program Integrity Contractor, known as the UPIC, and the OIG, the Office of Inspector General. So as we talk about each of these, the UPIC performs fraud, waste, and abuse detection, deterrence, and prevention activities for Medicare claims processed by Medicare Parts A and B, the durable medical equipment, and home health and hospice. These activities help safeguard the Medicare Trust Fund, like I said. And the UPIC works closely with other contractors, state certifying agencies, and federal agencies such as, and this is going to be a little bit of alphabet soup here, the OIG, the DOJ, the FBI, and assistant U.S. attorneys. And that's not an all-inclusive list there, but a lot of them are working together towards this common goal. Now, we talked about the OIG earlier, but they play a huge part in detecting and preventing fraud, waste, and abuse. They also work diligently to improve the efficiency of all the medical review programs. One thing that you may not be aware of is the OIG work plan. The work plan lists upcoming audits and inspections for the year, sometimes more than the year. And it's focusing on agencies like the Centers for Disease Control and the National Institutes of Health and CMS. It ensures proper use of federal funds and covers both mandatory legal requirements and high priority investigations. The OIG also operates a hotline that accepts tips and complaints from all sources about potential fraud, waste, and abuse and mismanagement in health and human service programs. Just because they receive a complaint doesn't automatically assume that there will be a fraud investigation. But every complaint that they get, everything that's reported will be investigated based on its merit, and it'll go from there. I've included 2 links here on this slide. One is to the OIG work plan, which is updated frequently. Usually it's by year, but sometimes depending on what the scope of the project is, it may extend past the calendar year. And then the other link is the page about the hotline. You may not have considered this, but providers are also essential pieces of the Medicare puzzle. A provider is licensed to diagnose, treat, and prevent illness or injury, and a supplier is approved to deliver equipment. So I wanted to define those. In the context of our discussion today, this also includes administrative and support staff, such as billing and coding, credentialing, those working with medical records, and compliance staff. Of course, that's just a sample. That's not an all-inclusive list. But when we say providers and suppliers, we also mean that support staff that works with them. Who else is involved in Medicare that you might need to be aware of? Well, we have the Beneficiary and Family-Centered Care Quality Improvement Organization, the BFCCQIO. Sometimes you'll hear them just referred to simply as the QIO. They're a group of health care experts, health quality experts, providers, and consumers that are organized to improve the quality of care delivered to people with Medicare. They act as an independent reviewer to protect Medicare beneficiary rights, focusing on quality of care complaints and urgent appeal reviews for service terminations. They ensure high quality health care by handling, for example, hospital discharge appeals, beneficiary complaints, and medical necessity reviews. QIOs also conduct higher weighted diagnosis related group reviews. If you're not with a hospital that bills and is paid under the prospective payment system, we call that PPS, you might not be aware of what a DRG is, but diagnosis related groups are very important to inpatient hospital claims for some facilities. So what they do there is they look at those inpatient stays on a post-payment basis, and they assess the accuracy of those inpatient hospital claims that have been adjusted to what we call a higher weighted DRG, which usually equals more higher reimbursement following that initial payment. So their goal then is to ensure that the claims accurately reflect coding and medical necessity, thereby safeguarding both the Medicare program's integrity and the beneficiary trust. You can get details about their scope of work by visiting the CMS webpage listed here, all about the QIOs. They also are dependent on state, so they are regional depending on what state you're in. Now, CMS holds overall responsibility for the Medicare system, while in practice, the operational maintenance and claims processing are handled by private contractors, primarily MACs, and shared system maintainers. These entities manage the technology, software, and data for Medicare Part A and Part B. Shared system maintainers are entities responsible for developing and maintaining the core claims processing software systems. Key systems include the items you see listed here: the Fiscal Intermediary Standard System, known as FIS for Part A claims, the Multi-Carrier System, known as MCS for Part B claims, the VMS, the VIPS Medicare System for Durable Medical Equipment claims, and CWF, known as the Common Working File, which is used to verify beneficiary eligibility and claims history. I refer to that as the patient's master record, Common Working File. There's also a single testing contractor that's responsible for testing the shared systems to ensure that they meet CMS requirements. Another functional contractor is the Beneficiary Contact Center, the BCC. In the BCC environment, beneficiaries have a single Medicare point of contact. That's the 1-800 Medicare call center that's operated by CMS. That will connect the beneficiary to a seamless network of customer service entities that can answer Medicare and related questions and resolve problems. Next, let's explore the SHIP. In Medicare, SHIP stands for State Health Insurance Assistance Program. It's a national network of state-run programs that offer free, unbiased, and personalized counseling to help Medicare beneficiaries, their families, and caregivers understand and navigate complex Medicare benefits and choices. SHIP counselors provide one-on-one guidance on enrollment, costs, plan options such as Medicare Advantage, Part D prescription drug plans, and Medigap. Also, cost-saving programs, ensuring beneficiaries make informed decisions about their health coverage. They also support families and caregivers by offering resources within the community for loved ones helping beneficiaries. If you're not familiar with the SHIP in your state, you can find out more about it by using the link on this slide and referring patients that need assistance. If you're in social work, if you're in patient scheduling, if you're in registration, things like that, where you, even the billing office or customer service within your office or your facility, you may need to refer patients who have questions about their coverage, about open enrollment, about what they qualify for, or what other resources are available to help them within your community. This might be a good thing for you to, put on a sticky note and have available so that you can refer people for education and advice. Next on the list of entities involved in Medicare is Medicare Advantage, also known as Part C. It's a Medicare-approved plan from a private company that offers an alternative to Original Medicare. These bundled plans include Part A, Part B, and usually Part D, which again is the prescription drug plan. Some of the plans offer some extra benefits that Original Medicare doesn't, like eyeglasses, hearing, dental, things like that. The link on this slide is for a very informative booklet on the Medicare.gov beneficiary website, but it explains what Medicare Advantage plans are. And then finally, the last entity that we have time for today is Medicare Supplemental Insurance, also known as Medigap. It's a private insurance that helps pay out-of-pocket costs like deductibles, copays, coinsurance that aren't covered by Original Medicare's Part A and B. They are standardized plans They offer consistent benefits, and they allow beneficiaries to use any provider who accepts Medicare. So there isn't a network that they have to follow or preferred providers. So it's a Medicare supplement. The link on this slide takes you to a Medicare.gov webpage that explains about Medigap coverage. You can also see what the different plans, they have letters associated with them. And again, they're standardized plans, but they're offered by private insurance companies. So what they cover and what they don't cover will be similar no matter who the carrier is. The prices will vary though. So now what? How does the information that we went over today help you? What are you supposed to do with it? Well, that could look differently for each of you depending on the type of provider you are or work with, what your role is at your office or facility, and where you are in your journey of learning about Medicare. Maybe you'll never have interactions with some of the entities that we talked about today, but hopefully it gives you a better understanding overall of how the pieces go together. I always like to give resources where you can find out more about the things that we discuss. And I did that throughout the presentation with links to various web pages and such. If you've downloaded the slide deck, you have all of these links. If you're listening to the presentation as an encore, again, scroll down to the description of the video to find them. To master Medicare billing, billers must prioritize regular ongoing education through the CMS Medicare Learning Network. And again, I've provided links here. This is CMS's official education hub. So if we jump out there real quick, and I'm saying real quick, hopefully that it's going to be real quick. There's articles, newsletters, web-based trainings. You can also sign up for the weekly Medicare Learning Network Connects emails, which I strongly recommend. And you can do that here with this middle box or tile. You can also scroll down to the footer here and put in your email address. That way you can sign up and you can decide the topics and how often you want to get notifications from CMS. Jumping back to the PowerPoint here. There's also additional training on the WPS website in our training center. Now I link to it, but you can find it up here in the top navigation bar. Our live events page where you can register for new webinars, find recent recordings in our encore presentations, or see our YouTube playlists. I also want to scroll down and specifically I want to talk about new to Medicare. Those of you that are just learning, we have a lot of resources out here that you can use as a jumping off point for you as you learn more about Medicare. And then we also, let me go back, we also have a section here for specialty and service training. So for example, if you're an ambulance provider, we have, again, different jumping off points, different resources, chapters within CMS's manuals where you can learn about things specific to your specialty or your provider type. So I wanted to share that with you real quick to make sure that you knew it existed. Then the last thing that I want to show you is the Medicare.gov website. And specifically, I'm going to take you to the publications page where you might be able to find things that can help you here. Thank you, but I don't want to do that right now. So on this publications page, if you have a title in mind or a subject in mind that you want to learn more about, you can use the drop down to select a category. Let's say general information or staying healthy, where if you want to find out about preventive and screening services. You can even change the language. Not all publications are available in different languages, but some of them are. What I want to do real quick is scroll down. Sorry if the scrolling bothers you. This one right here, Medicare, getting started. Again, these are to the beneficiary's perspective, but you can learn what's Part A, what's Part B, what do they cover, where can I go to learn more. So just as an example of the types of information that are out here for you. Now, I already showed you how to sign up for the CMS websites on our website. Just go right down to the footer and you'll find that box where you can put in your email address. So what I do is encourage you to bookmark pages that look interesting to you so you can come back to them. Even if you're not sure what you'll need just yet, you can go back and look at it. Lastly, I want to leave you with this. Medicare is a very complex and ever-evolving program. It's completely understandable that it's going to take time to become fully familiar with all of the aspects of it. I encourage you to be patient with yourself as you learn. It's important to give yourself grace during this process. There's no need to memorize everything right away. Focus on understanding those key concepts and then gradually add more to it. And know that with time and experience, the information is going to start to make more sense to you. Remember that learning is a journey. It's not a race, and taking it one step at a time is going to help build your confidence and your knowledge. Now, this is the section of our presentation where I would ask if there are any questions in the chat. In the sake of time, if you have submitted a question, I will review those and respond to you after the webinar. Please take a few minutes to complete a survey about this course. You have a few options depending on your preference. You can use the link that Ashley's going to place in the chat, or when you exit the webinar, you're going to be asked to go to an external site, and that external site is the CMS Qualtrics page for the survey. That message is going to look like the picture up here in the corner with the continue button and the little triangle. And we say that just so that you know that it's safe. It doesn't really explain where it's taking you, but it is safe and it's just for the survey. If you're listening to this course as an encore, you're going to get a box that's going to link you to the survey, and it's going to look like the other picture here with the hand and the stars. You can also scroll down in the description of the video and find the link there. Those surveys give us insight into how we're doing and the types of education that you're interested in. In a few minutes, you're going to receive an email. It's going to thank you for attending. And I don't want you to delete it without reading it, because if you need continuing education units, this email contains your certificate of achievement. It has your name and your contact hours. So if you need to turn it in for continuing education credit, you can do so. If you don't see it, check your junk or your spam folder and make sure you add the WebEx email address to your safe sender list. On behalf of myself, Ashley, and everyone else in Provider Outreach and Education, I want to thank you for your participation today. We hope to have you join us for future education, and we look forward to your survey feedback. You may now disconnect.